6. A 9-year-old left-handed boy presents to the clinic with his parents due to concerns over school performance. He previously hit all milestones and was an average student in school. Over this past school year, he had progressive difficulty with reading, but did not display behavioral problems at school or at home. His neurological examination and mental status. Examination are normal and show that he is able to write a simple paragraph in clinic. An electroencephalogram, EEG, is normal in the awake and sleep states. Which of the following is the most likely diagnosis? A. Infarct of the splenium of the corpus callosum and left occipital lobe. B. Landau-Kleffner syndrome. C. Developmental dyslexia. D. Mild intellectual disability. E. ADHD. The correct answer is C. Developmental dyslexia, also known as specific. Reading disorder is an unexpected difficulty in learning. To read despite normal intelligence, it is usually associated with a normal neurological examination and is without structural abnormalities on imaging. It is more common in left-handed males with a family history of dyslexia. An infarct of the splenium of the corpus callosum and left occipital lobe could cause alexia without agraphia, but this should come on acutely, unlike the progressive course in this case. Landau-Kleffner syndrome is an acquired epileptic aphasia in which children slowly lose previous verbal language and can have electrographic status epilepticus of sleep seen on EEG. Mild intellectual disability involves deficits in language, reading, memory, social skills, and executive function and is associated with an intelligence quotient between 50 and 70. Attention! Deficit hyperactivity disorder can lead to school problems in this age group, but typically these patients present with complaints of inattention, hyperactivity, or impulsivity, which can result in disciplinary problems at school or home. 7. A 23-year-old woman enjoys playing golf on the weekends with her friends. However, for the last month, she has not wanted to go, creating various excuses. She is frequently tearful, and her boyfriend often finds her crying in bed, wishing she were dead. Also, in the last month, her appetite has decreased, and she feels as if she has no energy. Her boyfriend states that she had a similar episode about 6 months ago. Which of the following diagnoses best applies in this case? A. Major depressive disorder. B. Major depressive episode. C. Dysthymic disorder. D. Bipolar II disorder. E. Seasonal affective disorder. The correct answer is A. The described symptoms of anhedonia, loss of interest, sadness, worthlessness, decreased appetite, and decreased energy all point toward depression. The presence of symptoms for at least 2 weeks, nearly every day, along with a change from her previous state, is classified as major depressive episode. However, given recurrent episodes more than 2 months apart, she meets criteria for major depressive disorder. Other common symptoms of depression include SIGI CAPS, sleep disturbance, insomnia or hypersomnia, loss of interest, guilt, loss of energy, loss of concentration, appetite change, increased or decreased, psychomotor, agitation or retardation, and suicidal ideation. Depression affects 10%, 25% of women, and 5%, 12% of men, and is more likely to occur when there is a family history, recent stressor, substance abuse, medical issues, pregnancy, or poor social support. Treatment involves both medicinal and non-medicinal modalities, including a combination of selective serotonin, reuptake inhibitors, or serotonin norepinephrine, reuptake inhibitors, as well as psychotherapy. In this case, dysthymic disorder is the incorrect answer because the patient's symptoms are more severe. Cause: disruption in her social and occupational function, and the onset was more acute. There is no indication that the patient has any symptoms of hypomania. Finally, there is no indication that the patient's symptoms had a temporal onset with a season change or that it remitted at a different time of year. 8. An 8-year-old boy has a history of developmental delay with an intelligence quotient, IQ, of 45. His pediatrician also notes that he has an elongated face with protuberant ears and enlarged testicles. His family has a long history of mental retardation. Which of the following is true regarding his condition? A. He has mild mental retardation. B. He has moderate mental retardation. C. He has severe mental retardation. D. He has the least common inherited cause of mental retardation. E. Women do not manifest symptoms of this condition. B. The patient has moderate mental retardation, MR, based on his IQ of 45. Normal IQ is 70. Mild MR has an IQ range of 55-70, moderate MR has a range of 40-55, and severe MR has a range of 25-40, based on the included description of his habitus along with a strong family history of MR. Fragile X syndrome is most likely. This is the most commonly inherited form of MR and is due to a CGG expansion in FMR1 on the X chromosome. Common physical signs include elongated face, high forehead, protuberant ears, and enlarged testicles. There is often a strong family history of MR, and men are most often affected due to the dysfunction of a single X chromosome. Females may also be affected by Fragile X syndrome due to X inactivation, lionization of the normal X copy. Their phenotype is generally less severe, though it often includes premature ovarian failure. Other causes of MR include chromosomal abnormalities such as Down syndrome, trisomy 21, Rett syndrome, Prader-Willi syndrome, Angelman syndrome, toxic disturbances, metabolic disturbances, and pre-perinatal birth injuries or infections. 9. A 7-year-old left-handed boy presents for evaluation of poor grades. The patient previously hit all developmental milestones, and in his first 2 years of school he progressed with the other children. In the last 4 months he has developed significant difficulty with his math class to the extent that he is now well behind his peers. However, he maintains average grades in his other classes. Neurological examination is normal and electroencephalogram EEG in both. The awake and sleep state is normal. Which of the following is the most likely diagnosis? A. Mild intellectual disability. B. Dyscalculia. C. Gerstmann syndrome. D. Attention deficit hyperactivity disorder, ADHD. E. Metachromatic leukodystrophy. The correct answer is B. Dyscalculia is the inability to manipulate numeric information, learn arithmetic facts, or execute arithmetic procedures in the setting of a normal neurological examination and normal cognitive function. Dyscalculia is common in patients with ADHD, but this patient does not show impulsivity, impaired attention, distractibility, or hyperactivity. Generally, patients with ADHD have problems in all of their classes rather than a specific subject. Mild intellectual disability involves deficits in multiple cognitive domains, including language, executive function, memory, reading, and social skills, and is associated with an IQ between 50 and 70. These patients do not develop normally, and impairments are usually known before starting school. Gerstmann syndrome involves left-right dissociation, finger agnosia, dyscalculia, and constructional apraxia due to a lesion in the dominant inferior parietal lobe, angular, gyrus or supramarginal gyrus, metachromatic Leukodystrophy is a disorder caused by a deficiency in the enzyme aryl sulfatase A, resulting in destruction of myelin sheaths. In the juvenile form, patients initially develop normally but later have significant regression. In school, eventually leading to muscle weakness, rigidity, vision loss, seizures, and dementia. 10. A 4-year-old boy presents to the neurology clinic for a second opinion regarding his complex constellation of neurological symptoms. He has a lifelong history of cognitive and motor delay with refractory epilepsy. He also has abnormal posturing of his arms and neck and may chew on his own hands if not monitored closely. On examination, he has minimal verbal output, cervical dystonia, upper limb dystonia, facial grimacing, and spasticity with hyperreflexia. He also has multiple excoriations and teeth marks on his hands. Which of the following is not an ideal treatment for this condition? A. Levodopa. B. Allopurinol. C. Purine-restricted diet. D. Tetrabenazine. E. Levetiracetam. The correct answer is E. The patient in this case has Lesch-Nyhan syndrome. LNS, an X-linked recessive metabolic disease causing elevation of uric acid due to hypoxanthine guanine, phosphoribosyl transferase, HPRT, deficiency. Clinically, LNS is associated with motor and cognitive regression after 3 to 6 months of age with early hypotonia, which later becomes spasticity. The patient may also have movement disorders such as chorea or athetosis, as well as aggressive and self-harming behavior. Serum uric acid levels are often elevated. The diagnosis of LNS can be made by clinical examination and by mutational analysis of the HPRT gene on the X chromosome. Allopurinol is a xanthine oxidase inhibitor and benefits patients with LNS due to reduction of uric acid levels. A purine-restricted diet also helps reduce uric acid. Both levodopa and tetrabenazine may be used for the movement disorders associated with LNS. Although patients may have seizures, levetiracetam would not be the best choice of antiepileptic because it may worsen aggression.